Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. Today, we are going to be talking mostly about COVID and flu, which people have been calling the twindemic that we may be seeing this winter. So, in the world of COVID, things are pretty quiet. In the world and in the US and in Oregon and Douglas County, things are pretty quiet. We're at one of the low ports of disease. Although, when we look around the world, there are a couple of warning signs. So we're starting to see an increase in disease in the northern part of Europe. So in Germany and France, Poland and Russia, we're starting to see an increased amount of disease. And that's a worry because when they've had disease in the past, in the falls, 6 weeks later, we've had it. And so there's a real concern that come mid-November, we may start to be seeing an increase in the amount of disease. In addition, when we look at the UK, which is really the best predictor of what's going to happen to us 6 or 8 weeks later, they too have had an increase in disease over the last 4 weeks and are now certainly not at a high level, but a much higher level than they were just a few weeks ago. So that's a suggestion that come November or December, we could see an increase in the amount of disease. Now, the disease that's out there is still mostly BA4 and BA5. But we're starting to see some other mutants start to nudge their way in. And so there's a BA2.75, which seems to resist previous infection and vaccine, and that's starting to take a little bit of a foothold. And then there's a BA4.6, which is also starting to rise a little bit, but it's pretty much all Omicron at this point. And that is the reason we are really stressing for people to get the booster. So again, the first vaccine was made against the ancestral strain, which was the one we had back in January of 2020, before it really had any significant mutations. And since then, there have been lots of mutations along the way. And so the vaccine that's directed against the early strain is not as effective. So now the new vaccine, the bivalent vaccine, has both the ancestral strain and the Omicron strain. And since it has both of those strains, it should give you much better protection against the circulating virus. And what we're seeing is that this new vaccine doesn't have any new or unusual side effects. And the other thing that we're seeing is that it gives very high levels of protection against BA4 and BA5, which is great because those are the things that are mostly circulating. So again, we are really recommending that people get the vaccine. We are still seeing moderately severe disease among those who have no immunologic history with this disease. So you could get immunologic history from this disease by either having the disease, having a previous variant, or having one or more of the vaccines. So for example, today there are 7 people in the hospital. None of those have been vaccinated. I mean, pretty striking that about 95% of the people in our county have either had the disease or had the vaccine. And so that the 5% that have had neither disease nor vaccine make up all of the hospitalizations is really stunning and suggesting that this is still a serious disease for those who have no history. So again, our recommendations, please go ahead, get vaccinated, and if you're eligible, get a booster. I got my bivalent booster last week. A little sore arm for a day, but not much else. Now I should have good protection against both BA4, BA5, as well as the ancestral strain. Also, last week I got my flu shot. Again, flu shots are going to be important. So again, flu comes around each year. The last 3 years, we've not had very much flu. And the reason we've not had very much flu is that those things that we did to protect ourselves from COVID, like wearing masks, distancing, and staying home, work pretty well for COVID, but they work really well for the flu. And so we've had almost no flu in the last 3 years. The concern is with no flu in the last 3 years, people's immunologic memory has gone down. We know there are a lot of people who didn't get flu vaccines during the time they were getting COVID vaccines. And because of that, we think we're kind of at a point here where we could have quite a bit of flu this year. And the concern is, and this is the twindemic, is that if you have flu and COVID both circulating at a time, this really could jam up our hospital systems. And what's most worrisome at this point is that our hospitals are pretty full right now. They are not full from COVID. So as I said, there are just 7 Douglas County residents in the hospital with COVID, but there are lots of other people in the hospital with all kinds of other things, maybe stuff that was left over from the pandemic. So there are a lot of people who needed hip and knee replacements, didn't get it before and are getting it now. People who needed stuff like colonoscopy didn't get it before and are getting it now. and just the stuff that happens. In addition, hospitals are struggling like the rest of us in hiring, and because they're struggling in hiring, they've not been able to open up extra beds. So in the last 2 weeks, the hospitals have been very full and have not even been able to admit all the patients. We had a call yesterday from Eugene that there was somebody who was needing to be discharged, and the word was that there were 25 people waiting to be admitted at Peace Health. So these are 25 people who didn't have a bed and they needed to wait for other people to leave so that new people could come in. This is striking because usually in September and October, the hospitals are the least full of any time in the year. And so for them to be quite so full now, nearly the breaking point now, before we have any COVID and before we have any flu, doesn't bode well for the winter time. And so what we're asking people to do is please go ahead and get the bivalent booster, and please go ahead and get the flu shot. Now, the question we have this week is, can you get the flu shot and the bivalent booster at the same time? Does it make a difference? It really doesn't seem to. So in the past, when we looked at people getting multiple vaccines, it did not seem to make a big difference in terms of immunoreactivity or about the side effects you're going to get. So in pediatrics, we give lots of vaccines at once, and it doesn't seem to be any different by giving them separately. So again, please go ahead and get both your flu vaccine and your bivalent booster. They're widely available. Most of the clinics have them. Most of the pharmacies have them. We had a drive-through through September. That's where I got my vaccine. And then they're going to be there every Thursday and Friday at the Colorcraft building, which is next to Kowloon's, catty corner from Abby's Pizza on Diamond Lake there. They're going to be there from 1 to 6 on Thursdays and Fridays throughout October to go ahead and get the vaccine. They do not have flu vaccine, but flu vaccine is widely available at pharmacies and at doctor's offices. So again, our best advice, as has been before, is please get vaccinated and boosted. If you're sick, please stay home. We know that when we look at these little outbreaks, almost always they start with somebody who is sick and decide, oh, I'd go to work or go to a party anyway, and then they spread it to others. So if you're sick, please stay home, get tested for COVID, and if you're positive, stay home for 5 days. Now, with the BA5 especially, we're starting to see some rebound. That is, people get it, they get better, and then a week later, they get it again. And that's probably something specifically related to the BA4 and BA5. If you get that, stay home again until you're well, and then you can go back to work. Again, we're at a low point in disease now. We expect it to stay low probably through Halloween, but then come November and December, we could see an increase. But we have a chance to slow that increase. If more people got the bivalent booster and more people got the flu, this again could be a relatively quiet winter, and that will allow our hospitals to have some extra space so that those of us who would need to get hospitalized for other things will have room to go to the hospital. So again, get your vaccine, get your flu shot. Again, this is Dr. Bob Dannenhoffer, Public Health Officer, Douglas County.